Hi, I'm Travis Burns. I'm an orthopedic surgeon with Christus Santa Rosa, Outpatient Sports Medicine, and Ortho San Antonio. I have subspecialty training in treating sports injuries and have expertise in knee surgery. Many people suffer from knee pain, and today I will discuss a few of the common causes and treatments. I will go over knee osteoarthritis, cartilage tears or defects, meniscus tears, ligament injuries, and tendon injuries. You have four main ligaments in the knee that provide stability to your knee joint. These ligaments are the ACL, PCL, LCL, and MCL. The ACL and PCL are located in the center of the knee and stand for the anterior and posterior cruciate ligaments. The LCL and MCL are located on the inside and outside of the knee. These ligaments work together to keep your knee from sliding, rotating, or tilting during knee motion. There are several muscles and tendons that surround the knee joint. The quadriceps tendon arises from the quadriceps muscle, which is a large muscle on the front of your thigh. The quadriceps tendon attaches to your kneecap or patella. Another tendon extends from the bottom of the patella and attaches to the top of the tibia. The patella acts as a fulcrum and allows your quadriceps muscle pulling through these tendons to straighten your leg from a bent position. In the back of your knee, the hamstring tendons attach below your knee joint and provide the force to pull your knee into a bent position and to extend your hips. Now that we have a general understanding of the anatomy of the knee joint, let's go through a few of the common causes of knee pain. Knee osteoarthritis is commonly associated with a deep aching pain on the inside or outside of the knee that is worse at the end of the day. With increasing amounts of knee swelling, you can also get posterior knee pain as fluid builds up in the back of your knee. Osteoarthritis is damage or loss of the articular cartilage of the joint surfaces. Specifically for the knee, arthritis involves loss or damage of the cartilage at the end of the femur and the top of the tibia. This is commonly associated with tears of the medial and or lateral meniscus. As arthritis progresses, it leads to joint inflammation, swelling, stiffness, and pain. The most common initial treatment for osteoarthritis is anti-inflammatory medications, therapy to regain motion and improve quadriceps strength, and injections to relieve inflammation. If these measures are unsuccessful, a knee replacement operation can be very successful at relieving pain and improving motion. We can also do a partial knee replacement if only one part of your knee is affected. Moving on to cartilage defects. As opposed to osteoarthritis, where all or most of the joint surface is affected, you can develop focal or small areas of cartilage damage. This commonly occurs on one of the femoral condyles or behind the kneecap. This causes pain focally over the site of the cartilage defect and is typically associated with sharp pain that is worse with weight-bearing activities. It also leads to joint inflammation and knee swelling. These can be treated with a variety of procedures depending on the defect size, location, and patient age. These procedures include harvesting some of your own cartilage, growing it in a lab, and implanting it at the site of the defect. We can also take cadaver cartilage to fill in that defect, and there are also options for partial joint replacements or metal discs to cover those areas of cartilage loss. Moving on to meniscus tears. The meniscus, or that cushion between the joint surfaces that we discussed, can be torn either medially or laterally. This causes sharp pain along the joint line of the inside or the outside of the knee. The pain is worse with squatting or rotational motions, and due to pieces of the torn meniscus moving in the knee joint, it can cause feelings of catching inside the knee or even blocks the motion if a big enough piece is displaced. Depending on the location of the meniscus tear and if it's affecting joint motion, it can be treated with medications, therapy, injections, and arthroscopic repair or removal. The arthroscopic surgery can be done through two small incisions about 8 millimeters, smaller than the size of your small finger. Moving on to ligament injuries. Ligament tears occur around the knee after sports injuries, falls, and accidents. Symptoms associated with tears of the ligaments include sharp pain during the initial injury, joint instability, and joint swelling. The anterior cruciate ligament, or ACL, is the most commonly injured ligament around the knee that requires surgical repair or reconstruction if the patient desires to return to sports and pivoting activities. Other ligaments around the knee, such as the MCL, commonly heal with bracing alone and don't typically require surgical reconstruction. More serious knee injuries with multiple ligaments injured commonly require surgical reconstruction to give the best opportunity for regaining a stable knee joint. Moving on to tendon injuries. There are numerous tendons around the knee, with the largest and most commonly affected being the patellar tendon, quadriceps tendon, iliotibial band, and hamstring tendons. These tendons can be injured with strains, complete ruptures, and with chronic overuse injuries. Complete ruptures are associated with immediate pain and loss of function of the tendon. For instance, if you completely rupture the patellar or quadriceps tendon, you'll have an inability to completely straighten your leg with sharp and severe pain over the site of the tear. The overuse injury of these tendons is called tendinopathy, which is commonly associated with sports, running, and jogging, and develops slowly over weeks to months. It is associated with aching pain with activities and point tenderness over the site of the tendinopathy. Hamstring injuries typically occur with sprinting or with forced flexion of the hips with the knees extended. A classic cause of complete hamstring ruptures is a water skiing injury with the skis getting caught in the water and the person getting pulled hard forward into a hip flexion with the knees extended. On the outside portion of your knee is a structure called the iliotibial band. This is a band of soft tissue that stretches from your hip across your knee joint. This can cause pain on the outside portion of your knee or hip and commonly occurs in runners. Tendinopathies and tendon strains are treated with rest from activities and sports, stretching exercises, anti-inflammatories, and therapy. Most full-thickness tendon tears require surgical repair to restore full function, but a couple of specific tendons have other tendons that perform similar functions and can be treated without surgery. If you are suffering from knee pain, stop letting it affect your activity level. See a knee specialist to begin the process of reducing your pain and improving your knee function. Please visit my website for additional information on knee conditions.